The COVID pandemic has laid bare the yawning gap and divide between the West and the less economically developed countries. Since the coronavirus began its spread across the world, many analysts have speculated about its impact. To discuss more on the geopolitical implications of the pandemic, I am joined now from Lagos by Dr. Tola Elesomi, a research fellow at the Nigerian Institute of International Affairs. Doctor, you are welcome to the Arise interview. Thank you very much.
Thank you.
When this pandemic began, it's like the Western powers were expecting that it will hit Africa hardest, maybe because of our climate, our poor infrastructure and others. But it looks like the pandemic is hitting them even harder. Is that correct?
Yes. Early by 2019, there was this prediction by the Western world that, Africa was going to be like a ghost town because of with deaths everywhere, because of the pandemic, because of course we have the weak and very fragile healthcare system and other issues we had in Africa. And so over the time, since 2019 till date, we found out that it's the other way around. Even though we've had cases arising from COVID-19, but the death rate has been low compared to what we have in the Western and developed countries. So for some have said it's because our testing capacities are very low, and so I mean we're not testing as high enough as we should compared to Western countries. However, we have also seen that the death rate has been less proportional than that of the Western countries.
Expectations that dead bodies will be all over African cities, but that did not happen, did it?
No, it didn't happen. It didn't happen. Of course, like I just said now, they had thought that Africa was going to be the epicenter of this pandemic, with deaths everywhere on the streets. We used to at that time in 2019, early 2020, we see deaths in Asian countries, people dying everywhere, coffins and corpses everywhere. And so Africa was projected to be the epicenter, but unfortunately, it hasn't been like that. And even though we've had high infection rates, but the deaths have not been what has been anticipated or projected by the Western countries.
This matter, Doctor, of vaccine hoarding, the Western powers developed the vaccines, and it looks like they are keeping it to themselves. And despite our exposure, very little relatively is being sent to Africa. And sometimes they only send the one that is about to expire. What is the politics of this matter?
I think the politics of the matter is what has been the division between the global south and the global north that has been in existence. I think this is just another manifestation of this division, the global inequality. When countries of the high-income countries vis-a-vis low-income countries, where such that in high-income countries, their citizens some have had the first jab, the second jab, and even taking booster shots. While for Africa and other developing countries, some have not even taken any shot at all. So it's really unfortunate where countries, because of course, vaccine nationalism, decide to even pay up production lines of these vaccines right even before they were produced, just to cater for their own citizens, without even considering other countries, other regions of the world. And it's been said everywhere that, safety anywhere is safety everywhere. And so the notion that, if I protect and provide vaccines for my citizens alone, I'm safe in my own corner, it has come out that it has been revealed that it is not correct. And so it's unfortunate that Africa is at the receiving end of all this, where a lot of in high-income countries, you have about 70% of their citizens already vaccinated and taking booster shots, while in Africa and other developing areas, some have not even taken a shot at all. And this is really is affecting lives, it's affecting livelihoods, it's affecting the global economic recovery is affecting countries, particularly in African countries, is an unfortunate thing. In fact, the Director General of WHO, Tedros Ghebreyesus, has called it vaccine apartheid. Several terminologies, have been used for this. So it's very unfortunate that Africa, is at the receiving end of this. However, for there to be an end to this global pandemic, to this scourge, there has to be global and collective efforts to end this scourge and this pandemic.
And then they do these red lists when there is a new variant like Omicron. They seem to be suggesting that we are the ones that produce these new variants and are exporting to them, and they close their borders.
Yes, it's unfortunate with what happened with the Omicron reporting by South Africa. That was late November. And the response, the global response was highly, highly unfortunate. And for me, I think it should have, South African scientists and public health officials should have actually been commended and applauded. And the governments even commended for its transparency. On the other hand, countries ran, to place travel bans on Southern African countries, just as if to say that it's, the Omicron variant emanated, from Africa alone. While reports have shown that other countries, even in Europe, Hong Kong and other countries, were reported cases. There were cases that were reported of the emergence of the Omicron variant. So it's highly unfortunate. It's highly unfortunate. For me, I think it will serve to also deter, countries from reporting the emergence of such, variants. If South Africa could come out to say, oh, this is what reports what we've discovered, and the response, the global response was for Western countries and high-income countries to quickly place travel bans and close their borders, it's highly discriminatory. And for me, it smacks of colonialism as it is.
Style colonialism. Dr. we thank you very much for your very interesting contributions.